Back. Welcome back to the Senior Scoop. It is our October show. Of course, we're filming here in September. And I am thrilled. I'm thrilled to be back. It's been it feels like it was a day.
I know.
But it's actually been a lot longer.
Yeah, we're 6 months into this.
6 months, 6 shows. I'm Bob Scott.
Maria Penna.
And we are here for another episode. But this time it is National Preparedness Month. That's right, September, even though you're seeing this in October. But you're going to be, this is a good times all the time.
It's not October, it's September.
It's September right now.
Yeah.
Well, when they hear this, it's going to be October.
Oh, okay.
But that's okay.
No, what are you talking about?
Actually, you know what, though? With the week I've had, I could be away a month off anyway.
Yeah.
It really wouldn't matter.
Mm-hmm.
And we'll get into that. But we've got some great stuff today. So we're going to talk a little bit about safety. I'm really excited to learn about this sepsis awareness. And we're going to talk about preparedness, the breast cancer prevention, vascular health, and in-home care. So we got a lot of stuff going on.
Got a lot going on.
How were you, though? How was your weekend?
Good. Grandkids all weekend, so I'm tired. But it was fun. It's always fun.
You know, it's been nice. The weather has been very nice. We've been very fortunate, and there's a lot going on. And you know what? I've got so many things I want to talk about, but I'm not going to get into it yet. I think we got to get into the show. We got to get our first guest up here. So, guys, welcome to the Scoop. You know, you can check us out on seniorscoop.org. You can check us out at
HarrigateLifeCare.org.
HarrigateLifeCare.org/seniorscoop. And also, we're gonna be having some fun. So we thank everybody that's been checking us out. And again, if you have any questions, if there's anything that you want to learn about anything having to do with, well, really, aging, life, hospital, doctors, let us know, and we'll get the experts in here. So we've had a lot of fun so far. Today's going to be another time.
Absolutely.
So we'll be right back, and we're going to get our first guest up here. So you guys hang on back because it's the Senior Scoop.
Welcome back. You're listening to the Senior Scoop with Bob and Maria.
All right, so we are back. And Maria, why don't you tell us who our first guest tonight is?
Our guest here is Kaylin Klinzig, and she is the Development Manager for the American Cancer Society. And she heads the Making Strides Walk in Point Pleasant, which if any of you have been out, it is amazing. So
welcome, Kaylin.
Kaylin, talk about that a little bit.
Well, first, thank you for the opportunity to be here today, and really excited to be speaking with you all a little bit more about the American Cancer Society, specifically our Making Strides Walk in Point Pleasant Beach. So I co-manage this event. It is actually, Making Strides is the largest breast cancer movement in the nation. We have over 150 walks nationwide, and Point Pleasant, surprisingly enough, is number 4. So it is the 4th largest walk in the country, and everyone wants to come from all over to walk on the beach and be a part of it. And we're really grateful to be able to continue it year after year. It will be our 31st walk this year in Point Pleasant. It'll be on Sunday, October 19th at the Silver Lake Lot in Point Pleasant Beach, right on the corners of Ocean and Arnold Avenue. The site opens up at 8 a.m. and the walk starts at 10. I encourage anybody that wants to get involved, get there as early as possible because there are so many things to do. We have a lot of unique experiences from our community partners, a lot of different activities to take part in. And actually, we have 22,000 people that come out to this event. So it's a very large event.
Whoa.
So when I say to get there early, it's because you want to make sure you can find parking, take our shuttle, get there, and again, have plenty of opportunity to see everything that takes place.
22,000 people. Can you walk me through the day? I mean, it's a walk, I'm guessing. So everybody's starting at the same time. Beforehand, are there events? I'm coming this year. I'm excited about it.
Good.
I'm wondering. So walk me through this. Actually, you know what? Can you walk me through the madness of your day that day?
I definitely can. Every year looks a little bit different. Obviously, the weather plays a major role in it. We're not even going to say anything.
The R word, no R word.
Exactly.
Yes.
We're not going to say anything about that. However, we go to the site the day before to set everything up. So we're there in the morning, and then we're there until it takes, however long it takes is how long we'll be there. Usually we're there until mid-afternoon, and then we go home, get some sleep, as much as we're able to anyway, and then we are back on that site as staff at about 5 o'clock in the morning to make sure everything's in place and ready to go.
Wow. And so now this walk, do they put together teams? How does the money get raised in events like this?
Yeah, absolutely. So We encourage anybody that wants to participate to register beforehand. You can either do that online, which is incredibly easy. It takes less than 5 minutes. You can register as an individual walker, or if you want others to join you, I encourage you to register a team. That way you can get others to join your team and together raise funds. So you can go online, or you could call our 800 number, 1-800-227-2345, and they can get you registered online over the phone. Really, it's a great opportunity. It's free to register. Fundraising is not mandatory, although it is highly encouraged. This year, together in Point Pleasant Beach alone, we are trying to raise $1.2 million. Wow. So we need every penny, and it really does make a difference in cancer patients' lives and their loved ones.
Wow. And Marie, you have a team, right? Do you have a team?
We have a team. I actually go with my family, but we also do a walk here at Harrogate.
Wow.
And every year. So we'll do a sale. We sell different kinds of breast cancer items. And then the day of the walk here, we do a bagel sale. We do t-shirts. We do hats. We do a little bit of everything. And then we walk the community. But I have been attending this event for probably since its inception. When I worked for the hospital, I used to always attend it. And then I'm a 19-year breast cancer survivor myself. So the walk became something different for me.
Congrats.
So, but I have to say, when you can't imagine it unless you go. Yeah. And when everybody goes to the line to start, it is just a sea of people and a sea of pink. And it is just truly amazing. And the feeling, I mean, me personally, since I am a survivor, just the feeling you get, you see people who are newly diagnosed, you see people, some in wheelchairs, you just see every aspect of breast cancer in front of you. And it is overwhelming, it is heartwarming, but the whole thing is they're raising tons and tons of money for research. So it's wonderful.
And I mean, it's amazing because especially with cancer, it's such an epidemic. And when you're looking at, the cures and the time that goes into it. I mean, when we've had the doctors for Alzheimer's and cancer, I'm learning now going through this with my father, but it needs so much research. Every person is different. Every case is different. So it has to be an ongoing thing. And it is such a close community. I know, like my wife lost her mom when she was very young, and the time has changed a lot where, probably now it might have been different, so
sure.
Things are changing, and you guys are making a difference, which is great. Can you tell me, how did you get involved in this?
So, funny enough, my mom started working in assisted living when I was very young, and she works in the activities department, held events, and a lot of times fundraisers. So I would volunteer with her, and being a part of planning those fundraisers and being involved in that made me realize I wanted to work for a nonprofit. So I've been in the industry for about 8 years now, and I've been with the American Cancer Society for 4 years. And I hate to say it, but everybody has been touched by cancer in one way or another. So my personal story, unfortunately, my cousin passed away from breast cancer at the age of 55.
I'm sorry.
So I was rather young, but it definitely impacted me. I think about her very often. And when I was given the opportunity to work for the American Cancer Society, I knew that I needed to do it. Because above all, yes, it is my occupation, but I need to work for a job where the mission is something personal for me. I need to know that I'm making a difference. And it's really nice because my whole family now comes out from all over the East Coast to come to the walk in Point Pleasant to keep our cousin's memory alive.
Oh, that's great. That's really great. And so you've been doing this for how many years have you been doing this now again?
This will be my 4th season in Point Pleasant Beach.
Very cool.
Yeah.
Very cool. And now is it the same day all over the place that this is happening, or is it just the month of October? How's it work?
Yeah. So all of the Making Strides events do take place in October because it is Breast Cancer Awareness Month. The one in Point Pleasant Beach is always the 3rd Sunday of the month. And we actually internally coin it Super Strides Sunday because out of the over 150 walks nationwide, the majority do take place on the 3rd Sunday of the month.
Oh, wow. That's good. So now, I don't want to say the R word, but what happens if it does R?
It is rain or shine. I said the R word. It is rain or shine. We are right by the beach. We walk up on the boardwalk, up on Jenkinson's boardwalk. So, dress accordingly. I highly suggest wearing layers if you do attend. It can get a little windy. I'll prepare you for that. But we take all the necessary measures, make sure everybody's safety is our number one priority always.
Oh, that's terrific. No, it's a great event. And what happens, if you just can't walk? How can you still support this? Is there a way to participate if you're not physically able to do the walk?
Absolutely. So if we have people that the date does not work for them, they have no interest in attending the walk, they're unable to walk physically, you definitely can still register online and fundraise. So that is really important because the event itself is October 19th, but our website stays open the entire year. It kicks off the month of January and it stays open until December 31st. So you can make a personal donation, you can encourage others to fundraise and donate on your behalf. So it's really important that even if you can't attend the event itself, you do still register online. You can join Harrogate's team. I'm sure they would love to have you be a part of it. And the other great thing is that you can fundraise to any capacity. Like I said, fundraising is not mandatory, but it is ultimately what moves the needle forward. So if you can't attend, you can still register online, or you can attend the walk and not walk. There's so much to do in the event site itself, so much to see, different tents to visit, activities to take part in. So definitely, if you're unable to physically walk, there's still plenty for you to do.
Oh, well, thank you for giving everybody this information. I know I was talking to Marie about it a while ago. We were talking about this day, and I've always wanted to go, and usually it does run into like a day when I have something going on, but this morning I'm really excited about it. And so now that you're on the show and you've told us all about you, guess what? I just have to say that, well, it's game time! That's right, Kaylin. So it's game time. I'm going to ask you a couple questions. Okay. Don't worry, we're going to start off with a very easy one. This one is but before you say the answer, I want to see how our studio audience knows about this stuff. It was mentioned earlier, but which color ribbon represents breast cancer? Is it blue, purple, pink, or yellow? Now, don't say anything. Who thinks it's pink? All hands go up. There they are. These guys are good. Do you agree with our studio audience?
That is absolutely correct.
That is 100% correct. We started off with a nice, easy one. Good job, Kayla. And now something a little bit more difficult.
Great.
I'd like it. And this is, Marie, you can help on this one too, but I'm wondering, in which decade did modern mammograms screening first happen? Which decade? Was it the 50s, 60s, 70s, or later? And don't say what later. Was it the 50s, 60s, or 70s for the modern mammogram screening? Now let's check these guys out here. You think it was the 50s? Hands up. Well, how about the 60s? How about the 70s?
I'm looking at Dr. Vida.
I know, right? I just don't know.
I'll go with his answer.
It's smart man. He doesn't want to get in trouble for this. All right. So now, Kayla, what do you think it was? Do you think it was the 50s, 60s, or 70s?
This is definitely more difficult, and you stumped me. I'm going to go with the majority, and I feel like I saw more hands for the 60s, so we'll go with the 60s.
Did you say the 60s? Kayla, listen, it has been fun, but you are correct. That's right. It was the 1960s was when they first started. And, having said that, I know with my wife, she goes twice a month. Unfortunately, we've got breast cancer pretty high in her family, and everybody should be getting checked out. I mean, what is it? What do they say? What age do you have to start doing these?
It's earlier now. I believe it's 40 now.
Yes, it is.
Correct.
40 years old. So make sure that you do go get your screenings. It's one of the worst things in the world when we find out that people could have been saved by just taking a little time and get their screenings done. So we're going to see you. I'm excited. I'm excited about this run. One more time, what is the number to call if they have questions?
So it's 1-800-227-2345. You can call to register for the event, but most importantly, it is our 24/7 helpline. So if you or anyone you know is impacted by cancer and you have any questions, you will automatically be connected to a trained professional. They'll connect you to resources. They'll talk you through anything that you may need, and they're there for you, again, 24/7, so you can call as often as you want.
Oh, man. Well, Kayla Klinsing, thank you very, very much for coming on and telling us all about the American Cancer Society. And we will be there at 3 o'clock in the morning, so we can meet you there today with the other 22,000 people that are going to be there. How about a big round of applause for our first guest, Kayla? Thank you so much. And we will be right back. All right. Well, we are back. We're back, and we've got a very special guest joining us, someone that's very familiar to everyone here at Harrogate. So joining us, we've got Dr. Vida. the physician who's truly become part of the Harrogate family for nearly over 3 decades, actually. Dr. Vida has cared for residents right here on the campus, bringing hospital-level expertise to the comfort of their own community. He's an internal medicine specialist with a reputation for patient-centered care. He's known to spend extra time with the residents and families, explaining conditions clearly and focusing on prevention as much as treatment. And today you're going to talk to us a little bit about sepsis and, some awareness and the conditions where early recognition can make all the difference. So thank you so much for coming, everybody. Let's hear it for Dr. Vida. So thanks for being here.
Thank you.
Over 30 years you've been here at Harrogate.
Since 1993.
So now how does that, what did you do before that?
I was a resident, actually, and I started coming down here part-time to do part-time work while I was still a resident coming from Newark.
Oh, wow. Wow. And so is it, now do you have an office here?
I do.
And do you have, is it just the Harrogate folks, or do you have other patients as well?
I have a private practice in the community.
Oh, that's really great. So you really know, so the residents don't just have a doctor, they have their doctor.
Yes.
You get to see everybody and pretty much know the whole crew here.
Yep. As well as taking care of them if they wind up in the hospital, unfortunately.
Yeah. That's a lot, man. Is it, how many people are here at Harrogate?
230.
230, that doesn't include the health center.
Wow.
Yeah.
Wow. So that's got to be a lot of fun.
It is.
Now, when you came from your residency, what was your main field of study?
Internal medicine with a little geriatric twist.
Yeah. And that's, I learned the hard way that it's, all medicine is not the same, especially when you're talking about geriatric. There's a lot of different things that can happen as you get older. And so having an understanding of that has got to be just really a comfort for the residents here as well.
There does need to be a different approach. Just like with pediatrics and geriatrics, you need to make that adjustment in whether the dose should be a little bit less or maybe a little stronger, depending on the person's condition. But even that application sometimes get missed in the general population as well.
Yeah. No, I think it's neat that you have such a huge, let's just say it's a massive practice, but it's under the same roof in a lot of ways. And when your clients come in, they must be like, wow, you got a nice office over here downstairs. But we wanted to bring you on, and sepsis actually, it's kind of interesting because I've been learning a lot about this infectious diseases as of late.
We all have.
Yeah.
Unfortunately.
Yeah, true. And with sepsis though, especially, what is it? What is sepsis exactly? What is it, and why is it so dangerous for older adults?
Sepsis, by definition, is an overwhelming infection that the body is succumbing to. And by the bacteria making toxins, it results in blood pressure dropping, kidneys failing, oxygen levels can drop. But that's the end stage, or that's what we see in the emergency room. That's the septic shock patient. Sepsis, mild or moderate, is where fevers, chills, sweats, maybe rigors, which is a violent chills, along with maybe a little confusion, lightheadedness, a little bit lower blood pressure than normal, some dehydration. Those are earlier symptoms. Confusion can be another one. And then it depends on which organ system is the origin of infection, which hopefully can help tip off the physician in the emergency room as to where the source is, and then try to navigate the choice of antibiotics.
That's insane. So it's not as simple as it's an infection in your blood. It goes into, you've got to know where it came from, the right antibiotics to use for that, and then I guess also the person's history. And there's a lot that goes into it. And once you have that infection in your blood, when does it get to that toxic shock? When does it get to that level?
It can get there even before it gets into the blood, but normally with what they call bacteremia, which is the typical term of blood poisoning, is where the toxins become overwhelming. The system's lost control. When we brush our teeth, we get bacteremia, which is bacteria in the bloodstream. But sepsis is bacteremia. The difference is that we brush our teeth, we get bacteremia, bacterial levels rise in the bloodstream, but then the body recognizes, oh, this is the one that I always see twice a day, and consumes it, arrests it. What happens in sepsis is the body is overwhelmed by that bacteria. It might not be a common one. It might be something that they got in the community or from an accident or a tragedy, and is as the body's unable to overcome the blood having that overwhelming amount of bacteria.
And how quick can this happen?
Sepsis can happen within several hours, and it could also smolder and be several days.
So now, if you're, and I mean, I'm only speaking from my experience. I've been dealing with coming from UTI into sepsis a couple times. What are some other, very common, let's say, infections that turn into this that we should be, looking for signals?
One of the most common can be strep pneumonia. So usually an upper respiratory resulting in pneumonia, but sepsis can occur in 12 to 24 hours, even in a healthy person, if it's a very strong strain of strep.
Wow, that's really some scary stuff like that. And what do you look for? Like, I know with my father-in-law, the weirdest thing is he doesn't get a fever, which is crazy, right? And that's what everybody's looking for. What are the symptoms that people should look for if they've got an infection and things change? What are the telltale signs to go to the hospital?
So like you're suggesting, in the general population, it would be low-grade fevers, chills, as we said, rigors, which is even more violent chills, lethargy, tiredness, fatigue, weakness, and then if it's an upper respiratory symptoms. If it's an abdominal issue, abdominal pain, bladder issues, bladder discomfort. But as you're suggesting, in the elderly population, it may just be fatigue, confusion, delirium, and no other symptoms.
So just terrifying. And the only way you can find out for sure is through blood tests, I'm guessing.
Blood, or in the case of urine, maybe a urine test as well.
So even if you have like a UTI, it doesn't. You can have a UTI without sepsis, but if you have a UTI, you can see the sepsis in that test.
Yes, the urine will tip you off that that's a source of why the person is septic.
Oh wow! So what do you tell everybody? I mean, how are some ways that we can, some precautions and things that we can do to kind of keep ourselves, at low risk for getting these infections beforehand?
If we're talking mostly about the urinary tract in the elderly population, it's exactly the watching for our loved ones to have more lethargy than usual, poor appetite, all of a sudden, a change in their daily routine, some signs of confusion or delirium, and then, of course, maybe a little bit of a low-grade temperature in the absence of urinary symptoms. But sometimes there are urinary symptoms, too. It could be as simple as incontinence, where a person wasn't as incontinent as before, and now all of a sudden they're losing their urine or their ability to hold their urine, or they're going more frequently. It may not be burning, but they're going more frequently.
And why is it that everybody, like, it's commonly thought that you get this in a facility, or you get this in the hospital? Is it just because that's where you actually finally get tested? Is that what it is?
No, the you get this part, I think, comes from that there's two very common infections that occur while being hospitalized or in a nursing home setting, and that is urinary tract infection and respiratory or pneumonia. The reason for those are because the patient tends to be bedbound or mostly in the bed. And so because of that, aspiration is very common. So the upper respiratory and pneumonia and urinary, they're often incontinent of urine and stool. And so because of its logistics, there runs at higher risk.
Wow. So that's interesting, and also that's just not really fun. I got to tell you. So now I want to talk about a little fun. What do you do when you're outside of this place?
I like to fish. I like to boat. I like to ski, although I'm getting a little too old for that.
Yeah. What kind of boat? I'm a boater. I love it.
I have a center console, 26 foot.
Oh, nice. So you fish. Yeah, some fun. Yeah. Now right now it's a little bit unique. The weather. It's been fun.
Yes, we've had good weekends.
Oh, it's great. So you're fishing. Do you live around here?
I do, in Brick.
Oh, okay, yeah. Me too. But we'll hang out. We'll go fishing. Okay. But but for 30 some years, you've been, actually 32 years, right? 32 years you've been here at Harrogate. You have a funny story? Do you have like a case that was just like, without names, that was just like, wow, man, I like it here. This is cool to be in my place, and I get to see him afterwards. Don't say no.
I guess I do. What I'll do is give myself time to think of that funny story and tell you that one of my secrets is that Tuesday is my favorite day. And what do I do on Tuesdays? I come to Harrogate, and I've been doing that for 32 years.
Oh, wow.
So my private patients in the community don't know that, so please don't tell them. Oops, it's too late. Funny story? Gosh, you're getting me there.
Or something that was just
So
like
many.
baffling, something different, because I think about the idea of, when I grew up, I don't know if you know that, my doctor was Dr. Cahill. Dr. Cahill lived in Spring Lake, and
I knew Dr. Cahill.
Oh, yeah. And I would actually go to his house and part of his house, and my mom knew him. It was like that kind of atmosphere, pretty much like if you were in a home, like if you were in this place, right, where you have all this
More home-like, yeah.
more home-like, and I think that I could see a lot of people coming in maybe a little bit more frequently than they need to, just because they got the doctor downstairs, and maybe you become more of a social visit for some of them than maybe doctoring. And I'm just wondering if that's might have given you some giggles outside of this place.
So I do have one. You gave me a couple minutes to think. Back when, this is back in the late 90s when Viagra was invented and became popular. That, of course, gentlemen were starting to come in and ask for a little bit of help, and some gentlemen didn't know to ask yet because they hadn't seen the commercials. It wasn't as popular yet as everybody knows now. It's a household name now. And I was bringing up the conversation with a gentleman in his mid-80s, and I was offering that, there's something that I could do now to help. And we had the discussion about the medicine, and then he said, well, how much is it going to cost? And I said, it's about $10 a pill. And at that time, insurances weren't covering it. So he said to me, Doc, I have never paid for sex in my life, and I'm not going to start now.
That's pretty good. Oh gosh, I can't even imagine the fun that you back with that when I was coming through. Well, Doctor, I'll tell you, I do appreciate meeting you, and I think it was very nice as soon as you came up here. I know that the residents here, they enjoy having you in. And it's just great to meet the people that actually make a difference, and we appreciate that. But you're not leaving without playing a game. I'm sorry. So it's time for game time. That's right. I got a couple questions for you, but I won't make them as difficult as the last one. Maybe we'll see. Now, this is true or false, and we're going to get this out to our audience here, and then see how we do. Let's see. Sepsis can occur from something as minor as a small cut or scrape if it becomes infected. Just a small scrape, if it becomes infected, can that cause sepsis? Let's see. Hands up for true. Hands up for false. Doc?
It's true.
Yeah, it's true. Just a little tiny scrape. As soon as there's an infection involved, they can do it, eh? Well, that's not fun.
No.
And now how about this one? All right, so rapid breathing and confusion can be an early warning signs of sepsis, but shortness of breath, long breathing, just irregular breathing in general is a reason that you may want to bring your loved one in. Breathing in general is something that can be a sign of sepsis. Is this true? Let's see out there. True? Breathing? Breathing issues? Just that? How about false? Out there, breathing issues? Doc, what do you think?
Breathing issues.
Yeah, we're right. This guy is 2 for 2. That's right, 2 for 2. It's a good thing I didn't go with these 30. The size. And then our third question is, Doctor, what is regulations 2025 for fluke this year? What is the size limit that you have to do? I think, was it 19 and a half or something like that? It's not ridiculous.
16.
16, that's a lot, right. I threw way too many back this year, that's what it is. So, Doctor, thank you so much for coming, guys. Give him a big round of applause. Dr. Vida, right here at Harrogate on Tuesday.
Harrogate, this station, or their affiliates. The content provided should not be considered medical, legal, or financial advice. For personalized guidance, please consult with a licensed professional. Listener discretion is advised.
Welcome back. You're listening to the Senior Scoop with Bob and Maria.
That's right, ladies and gentlemen. We are back, and it is time for our community corner with our WJ. That's right. This is presented by Community Medical Center, and joining us today is vascular surgeon Dr. Issam Koleilat.
Perfect.
And he is a specialist in both advanced minimally invasive procedures and traditional vascular surgery. In addition to his surgical expertise, Dr. Koleilat holds a master's in public health, giving him a unique perspective on how lifestyle and community factors shape vascular health. Fluent in 4 languages, which we're going to talk about in a second. He connects with his patients in many backgrounds and is passionate about early detection of PAD, which he's going to explain to us in a second, and helping seniors maintain strong, healthy circulation. Have a big round of applause for our Dr. Koleilat, community partner. Welcome to the show.
Thanks for having me. It's a pleasure being here.
Yeah, you talk just like a doctor. That was well done. I like that. So tell us about PAD. What is this peripheral artery disease, and why is it so serious?
Well, peripheral artery disease, many people are familiar with like blockages that people get in their hearts that can lead to heart attacks. It's the same idea, but it happens mostly in the legs.
Oh, okay.
So blockages in the blood vessels in the legs. And just like a heart attack, you can get a leg attack, which would mean that all of a sudden, out of nowhere, the blood flow to your leg is interrupted, and that can impact walking. That can impact if it happens over a long period of time instead of just over, seconds or minutes, sort of a more immediate event. But if it happens over a long period of time, then that can lead to pain with walking, can lead to wounds in the feet that don't heal, and it can even lead to gangrene and subsequently amputation.
And is this a circulation thing? Like
This is absolutely a circulation thing.
Oh, wow.
So for a doctor, it's difficult because different people use the word circulation different ways.
Okay.
And a lot of people think that like when their feet go numb because they've been sitting too long, that's a circulation issue. And usually it's not.
Oh.
So it's fun for us to tease out some of those things in the office. But this is definitely the circulation thing in the legs, peripheral artery disease.
Now wait a minute. Let's get back to this sleeping legs, not a circulation thing. So when my legs go to sleep, it's not circulation.
Yeah. So if for most people, if you sit on the toilet too long, not you personally,
no, it's me. It's me.
but if you sit on the toilet too long and your legs start to go to sleep, that's usually because of a pinched nerve somewhere along from where the nerve exits the spine down into your leg.
Wow.
So things like sciatica, or, if you're like me, my sciatica is because I have a muscle in my butt that gets really tight from overuse and exercise. Mm-hmm. So stretching for me is important to keep that muscle nice and loose and not pushing on the nerve.
See, I just thought it was that third episode of Candy Crush.
Exactly.
Legs go to sleep. So as soon as you get up then and the blood starts going back, and I guess that nerve becomes unpinched, that's when you get the blood back there?
Yeah, so not to speak for my neurology colleagues and our spinal surgeons, but yeah, different things can release the pressure on those nerves.
Like a kink in a hose, right?
Well, a kink in a hose would be more like an artery problem.
Okay.
With the nerve, it'd be more like pushing on your electricity wires in your walls.
Oh wow.
Okay.
And there's four languages, so we had a little fun with that before. So this says that you speak English, Arabic, French, and Spanish. But what did you say, Ross?
Well, so I said, you asked me if I speak all of them fluently, and I said for the most part, my Spanish is more medical than regular fluent, and you weren't sure what to do with that, so I said, I can talk to you about your veins all day long, but I have trouble ordering a taco at the restaurant.
That's cool, right? So now, how did it, with the languages, I mean, that must have been very unique. What were you doing before you came to community? You came in 21, you said?
I did. I came in 2021 on the sort of the heels of the pandemic first and second wave, or however you want to count that. But before that, I was a vascular surgeon at Montefiore Medical Center in the Bronx.
Wow. And what made you go into vascular science, I guess?
Oh boy. I mean, everything. I love the disease process. I like the patients. We get to operate and work on blood vessels all over the body. So it's really rewarding.
Was there any other field you were looking where back in the day when you were like, which one am I going to really go after?
Oh my God. My story is a long and tortuous one.
Well, listen, we didn't have somebody show up, so go for it.
Well, when I thought, as a medical student, I wasn't really sure. I knew I wanted to be a surgeon. And at the time, when I was a second-year medical student, a cardiac surgeon came to our open house, meet the specialties kind of night that we did. And he just, personality-wise, I just didn't jive with that individual. And then, I thought maybe I wanted to be a neurosurgeon, but also those surgeries are very long and arduous, and sometimes you address the problem, but the patient doesn't do as well because obviously you're working with the brain.
Yeah.
And so landed as a medical student. I said, all right, you know what? I want to do plastic surgery. And I thought I was going to be a plastic surgeon. And I applied to both plastic surgery and general surgery because there are two different ways that you can do that training. I didn't get into the direct plastic surgery programs. I got into general surgery.
Oh.
Did a month on plastic surgery as a general surgeon trainee, and I hated it.
Yeah.
And that was because, the program there at the time was going through transition. So they weren't doing the cool, like, breast cancer, as we heard earlier.
Yeah.
Some of the breast cancer reconstruction surgeries and some of the, lifestyle stuff, and a lot of their cosmetic stuff is done outside of the hospital. So I didn't get to see any of that. So I just saw a whole lot of wound care. So I was lost for a while. I thought maybe I wanted to do colorectal. I figured that's nice. They do big colon surgeries. They can do laparoscopic sort of keyhole surgery, open surgery, and then when I got ready to retire, I could retire into proctology. Seemed kind of a weird thing to think about as a young, mid-20s something, but yeah.
Our path was very close.
Yeah. And then I ended up, so general surgery is 5 years of training. In my fourth year, I did vascular surgery, and I just fell in love.
Wow.
Yeah.
It's really
The clouds parted and the sunshine,
So, and it's probably like it's an ongoing. I mean, it's all connected, right? So it's really, you can find a spot. It's almost like the pressure points and understanding how one little spot can control everything else in the rest of the body, right?
Yeah. I mean, it's definitely, we just had a patient recently who had been complaining of back and hip pain for the longest time. And as it turns out, he had a blockage in the main blood vessel supplying both his legs. And just with a simple stent procedure, he was able to, he came in the morning, went home in the afternoon. And now all of a sudden it's like, Mary Poppins. I mean, he can jump and click his heels and
Wow.
Wow.
Incredible stories.
So, I mean, it's kind of interesting because we always kind of just key in on the brain and the heart, and that these two things, they need the blood flow and they're going to make everything else go. But if you've got a bad vein somewhere, it could have nothing to do with you, right? And it could,
Right. I mean, just like a car engine, if you can't get gasoline into the engine, then the engine's not going to pump. So the same idea. I mean, if you have blockages in the neck, that can lead to strokes. If you have blockages in the legs, that can lead to mobility problems, gangrene, amputation. Blockages in the heart, those are dealt with by cardiologists, but the same idea. You can get heart attacks and troubles.
So how do you go about, like, I go to my doctor, I get my blood work. Is this something that can be seen in blood work? Like, what's the path to find out if everything's going all right,
That's a really great question because we don't have good screening tools or recommendations right now. So a lot of people there's no blood test, for one. There's a blood pressure cuff test where you compare blood pressure at the arm and the ankle. But the problem with that is that even if that test is abnormal, if a person's not having any symptoms, we don't recommend that they have any procedures or interventions or treated unless they're having symptoms. So then the question is, well, why should you do the test to begin with? So the United States Preventative Services Task Force, the group that gets together and looks at all the data and the costs and sort of has a 10,000-foot view of this, does not recommend any screening right now for peripheral artery disease because it's just not worth
Well, it costs money.
finding it. Yeah.
Yeah, I mean, what are these signs like? What is something that maybe we wouldn't think about? What's a symptom that we might be having that maybe we should go see a doctor,
The most common symptom of peripheral artery disease, 90% of people that are going to have a symptom have this, and it's calf pain, sometimes hip, thigh, or butt pain when you walk.
Oh,
Yeah.
that's like everybody I know.
Yeah, exactly. I
Yeah,
know.
so
Right.
really, and so even that's like that sciatic feeling, all of that.
Sometimes it can be tough, and a lot of people have both. They have both sciatica nerve pains and they have peripheral artery disease. And so it's important if you have any concern about that to be seen by somebody who understands both those disease processes.
Now, see, I have this weird theory, and I'm not that person, but it's ever since COVID, right? Like all the things that were going to happen to me just happened faster, right? Like my voice, I had to get a voice surgery afterwards. I knew I blew it out as a kid, but I didn't know it was going to happen. My back, now I got like all these things going on. I'm just wondering, like, have you seen more since COVID? Have you seen more blockages? Have you seen more people coming, or is it just a matter of like people are now going to the doctor more? Like, what do you think? Anything?
I think it's a little bit of both. So It's really interesting. I think what people didn't realize is that we were watching with COVID. We were watching a brand new disease like unfold before our eyes, and we were watching the medical community kind of learn about it. When I was at Montefiore, we actually published research on COVID, looking at blood clots and artery blockages with COVID, and certainly they were much higher with COVID, and they were in unusual places. So places you would typically get a blockage or a blood clot, that's where COVID. So now, anytime somebody has a weird location for a blood clot, we say, oh, you better test them for COVID.
Wow.
So definitely we did see some differences. And I think I don't study COVID like the infectious disease and microbiologists do, but I think that the prevailing idea now is that it's an infection of blood vessels.
Yeah. Wow. So that's right up your alley.
Well, sort of, yeah.
Trying to get in there. It's an amazing thing to think about how just one vein or one canal. I mean, and will you go in like this is plaque, right? Plaque will get into the veins, and that's what you got to clean out and such.
Correct. So you can get, if it happens over time, it's usually plaque, which is the blockages that we talked about earlier, similar to the stuff that can happen in the heart. If it happens all of a sudden, usually it's not hard plaque, but softer clots.
And so what is something that everybody can do that maybe can hopefully prevent these type of diseases?
So definitely for patients who are at risk, and you should talk to your individual doctors to determine your level of risk. But we recommend that people who are at risk take a baby aspirin a day. Make sure if they have diabetes, that they take their diabetes medication. If they have high blood pressure, that their blood pressure is managed. Even in patients, in patients who are at risk for peripheral artery disease, we know that even if their cholesterol is not high, they benefit a lot of times from a cholesterol medication. So having that conversation with your primary doctor or your cardiologist is really important. And the most important thing that I cannot stress enough, which is why I left it for last, is to quit smoking.
Yeah.
If somebody's smoking or being exposed to smoke, so if you live with somebody at home who's actively smoking, even if you're not, you're smoking because of that secondhand smoke. And that's the most important thing that somebody can do for their heart health, for their brain health, to prevent strokes, and for their vascular health.
It's amazing too. It's funny. I was just talking to a buddy of mine. It's like, as a world, or not the world, but as a country, we've done a job. I mean, like when we were kids, smoking was cool. It's just not anymore. You know what I mean? Like it's really something. I mean, I know they get the vaping and all that stuff, and it's the same badness, and I get that. But it is funny to smell somebody smoking now. But that doesn't take away from the fact that it's just a impossible thing to quit. It's very, very difficult. If you got hooked on it when you were younger, it's really, really difficult.
Absolutely. I tell all my patients that anybody who quits smoking is my hero because it's so difficult.
Yeah.
And if I can plug the Barnabas Health Tobacco Cessation Program, they have a wonderful program in the system that will call you and set you up with support groups and send gum and patches and whatever else you need. It's a great resource that we routinely send our patients to.
Well, I got to tell you too. I know you're here with the community corner, and I don't want to go too much away from this pad, but I
just have one question.
No, do it. Please.
I know. What about a calcium score test?
That's a great question. The calcium score test right now is being used to look at blockages in the heart.
Yeah.
And we don't really have that much information about what does that mean for blockages elsewhere in the body. So we think that blockages, hardening of the arteries, atherosclerosis, if you've heard this term, but that hardening of the arteries doesn't really select heart versus neck versus legs. Certainly people have symptoms in different areas, but we think that that's a process that happens throughout the whole body.
Yeah.
So we almost assume that if you have it in one place, you're going to have it in other places.
You know what? That's interesting though too. I mean, our body's kind of like, if you think of it as, well, because I'm from Jersey, I'm always like with the turnpike and the parkway, right? So you've got your roads that are going to get you north and south, and you can decide if you want to pay a toll or not. And we're going to call the big arteries those toll roads, right? But you got a lot of other roads in there. So if one's blocked up, if everything else is moving smooth, you're okay, right?
So if your service roads are doing all right, I've used the same example.
Yeah.
If your service roads are doing okay, back roads, you can take Route 9 instead of taking the Parkway, but no tolls. But if now you have a lot of traffic going on Route 9, those lights are going to stop it. So you are going to have eventually some symptoms. But that's why this happens. This can happen over time without people getting gangrene right away, because your body does, it's an amazing thing. Your body does have different avenues to get those blood vessels, to get that blood flow down to the feet.
It must be very difficult though for you, because it sounds like there has to be almost another doctor involved, right? You have to, you're working with a cardiologist. So it's not like somebody can't come to you and you can give them a solution right away, can you? Or is it like, oh, you can?
Yeah.
Oh, look at you.
Yeah.
So
We do it all.
if I've got these pains or I'm work, but do I have to get, does someone have to, referral? Do I have to get a referral to come to you? How does this work?
I don't know that in New Jersey, I think you can see a vascular surgeon, you can see a specialist. That sort of goes back to your insurance and
Okay.
what they determine. But I think a lot of our patients just, come to see us.
Traditional Medicare or something like that, you wouldn't need a referral. Just if you had a Medicare D, maybe.
Okay. So
So
walk me through this now. Like, and I know really you've had all of these different things. So if you got some pain in your back, you go to your doctor. He's like, listen, we did an MRI. You don't have any bulged discs or anything. You should probably go see a vascular guy. So you go to the vascular guy. You find out that there's a couple blocks here and there. So now you're working with that person, and between medication or surgeries, you can get all of that taken care of. But I'm guessing then you're looking for your clearances from your cardiologist and everything else to make sure everything else is going well.
Yeah, so it depends on what kind of procedure the person needs. But yeah, a lot of times we'll get, a medical evaluation or an evaluation by a cardiologist to make sure that a person's in the best shape that they can be before we embark on something more serious.
Wow. And so and when we talk about those treatments, I mean, what are besides your surgery, and are these surgeries major? Are you out for a while?
Yeah. So it depends on where the blockage is and how severe it's impacting somebody's life. I had a professor in training who used to love to tell us that vascular surgeons are like cobblers. You come in, we feel your feet, we talk about, what you do in life, what do you want to get out of life, and we make a pair of shoes for that person. Then the next person comes in and you rinse and repeat the whole thing all over again. And the two pairs of shoes may not be the same because it depends. So I had a patient in the Bronx who could barely walk a block because of his blockages. And I said, well, does this impact your life? And he goes, nah, man, I'm a cab driver. What do I need to walk for? And so for him, we just observed,
Wow.
Make sure he's on maximal medical therapy and manage him medically. I had a patient who was a carpenter who couldn't do stairs. And I said, what's the big deal? Just avoid stairs. He goes, no, if I can't do stairs, I can't do carpentry. And if I can't do carpentry, I can't do life. And so for him, we did something, even though he could walk flat surface, he could walk a long time. So it really varies. What are the treatments? We talked about medical therapy already. Earlier, I mentioned stents. So we are able to use balloons or stents through minimally invasive procedures. To open up blockages. That happens a lot of the time. Sometimes we have to do open surgery, which involves incisions either on the belly or the leg. Sometimes we can do combinations. So we can make a small incision in the groin, clean out a blood vessel there, and then use stents on the inside of the blood vessel for the rest of the thigh or up in the pelvis. So that's the kind of the fun thing about being a vascular surgeon, is that I get to think about and design a surgery for every individual patient.
Is there like a music you have on in the room when you're doing these things?
I love to, so you may not know this, but we also have medical and surgical trainees at Community Medical Center now who are fully fledged doctors, and they're working to become specialists, whether internal medicine or surgery or whatever. And a lot of times when we have somebody new in the room or like a medical student, I like to ask them to choose the music. So that, they get all nervous and they feel the pressure. But I'm pretty eclectic, yeah. Yeah,
it's really wild. And I got to tell you, so you've been with Community Medical for, going on 5 years.
Almost 5 years.
So I've got to tell all of our folks out there, all right, so we've been doing this show, we've been having the partners with Community Medical Center. I had to bring my father in for UTI that was going really bad. So we live literally 10 minutes away from Brick House. But I've already spent time there. And then I spent time at Jersey Shore. So I'm like, well, I'm doing the show. I'm going to go over to Community Medical. I'm just going to go over there. I'm not going to tell anybody. I'm just going to go. So my wife, now, I think we're going to have Pat next month. We're going to have Pat. And
that'll be a treat.
Yeah, so that'll be fun. So I was going to save this line for him, but I'll tell you. I was like, that place didn't always have the best name back in the day. But my wife's like, listen, you know what? Let's give it a shot. So we go. It was by far, out of Brick, out of Jersey Shore, the best experience. And when I say the best experience, let me explain why. So this man has been suffering from this UTI situation He was in here. Like, it has been going on since May, okay? We've spent weeks and months in hospitals. The first doctor out of all of the doctors that said, you know what? UTIs, there's different bacteria. There's different UTIs that you can have here. We want to find out which bacteria you're actually working with here so that we can treat it properly, was at community. Not only was it that was our ER doctor. Then he followed up and called us when we got home. The ER doctor called us to find out what was going on and said that he found something very strange in the culture, and that he sent over to another doctor who was our hospitalist, this Dr. Patel, who was amazing. The whole experience, I've never had an experience with an ER, and we were there late, and there was a ton of people there where everybody was working with each other. The person who watched my father-in-law, which unfortunately kind of gets a little crazy with these things, so he needed somebody to watch. She was great. The nurses were great. And they made it very apparent to me that they have made a humongous push for geriatric care. And so what that means is not only the science, but also the understanding of a senior, a lonely senior, someone that cannot advocate for themselves as well in that situation. They're taking that into consideration, and I saw it firsthand. I didn't tell them I did the show. They didn't know who I was, and I was going to be very honest when I came back. And I'm going to tell you guys, that is the hospital I will go to moving on for myself. That ER is out of control. Unbelievable. Fastest service. All the doctors were wonderful. And I really mean that. For myself and my kids, I will go to community from now on. I really mean that. And I'm telling you, I grew up with that's where you go to die. So I was scared. I was nervous. I was nervous about that. But if you have not been there when you really need it, you should go there, because they're thinking differently, and they're really putting time into their staff. For instance, what I found out, which I think I really shouldn't say, so I'm going to anyway, they reward folks for good, like in other words, if you write a letter to the hospital, everybody writes bad letters, right? But those good ones, when somebody really made a day for you, get that person's full name. Because when you do that, they reward those individuals. And this party that they would have for these individuals back before they did all this change, they'd have like one a year. Then they have like 3 a month because of how many people are saying this nurse made a change or this person did a change. I'm very excited about it. I really am. And I tell you, they made a big difference in my life. And when he got another UTI, her sister-in-law was like, let's just go to break. We know what it is. It's 5 minutes away. And my wife was like, no, we're going back there. And I learned that you can actually choose your hospitalist, which this is something I never knew. If you go to the hospital once and you have someone that really is caring for you well, your hospitalist, when you go back, if you go back, ask for that hospitalist. I did not know you could do that. You're not just assigned who it is at that moment. You can actually ask for that person. And I'll tell you, that has made a humongous impact in our life. And I will drive, even if it was 40 minutes away, I would make that ride. It was the best experience I've had in all my years. It's 18 years in Brick, it's the best experience I've had. So you guys are in good shape. I'm excited for you.
Well, I'm glad you had a great experience. I'm sorry you had to be there. You don't have to go back.
I'm spending much time. Actually, it was nice. I'm getting really used to it. It is big, though. It's very big. It's very, very big.
Yeah. Now with the construction, it's going to get bigger, but right now it's even more difficult to navigate because some of the roads are closed and things.
But what's nice is like you do have, it's, if you go to the hospital, you have the emergency room, but you guys have an emergency room like garage. So it's very separate, and I think it's very simple too, because when those are the times where, you're a doctor, you understand that, like, it's funny, I had a great boss, and he taught me about paramedic mode. It's not my emergency. It's not my emergency. I've got to go in there with a calm, cool head, right? So I've used that a lot with my kids when my wife is freaking out and the kid breaks his arm and everything. I'm like, yeah, it's fine, it'll be fine. But when you're going to the emergency room, you're panicked to begin with. So the simplest things of like, where am I going to park? Can I pull up here and get out and get in there? That stress are the things that you don't allow your brain to take care of. They've thought about that. They have a place to drop off. They have a garage just for the emergency room. They have an entrance just for the emergency room. This, to me, was really something special because those are those little things at the end of the day where you don't think about it. You're on your way there and all you know is hospital. And you're like, all right, where am I going to go? Well, this made it very simple. The security is great. The waiting room is great, to the point where when people would go there and check in, the whole process is really exciting to me. And I'm not kidding. You guys know me, I would tell you the truth. I'm not kidding. Especially for geriatrics, I've heard that they're now putting in Geriatric gynecology, they're going to that level. They're going to, all of these geriatric type medicines. And when this man was talking to my father-in-law and explaining what was going on calmly for the first time in 4 months, and he just met him, that spoke novels for us. And I mean, I couldn't get over it. And since then, social work team has been involved with me. Everybody's been involved. I haven't heard anything from the oncologists at Jersey Shore. Not one thing. So I'm really excited about this, and it's a pleasure meeting you. And every person that has been on this, the reason I went there was because every person that's come from your place has been really fun and great to talk to, and just real people that this is what they do. This is what Marie and I do. This is what you do. And when we can kind of say, you know what, it's really special. I see the joy you get when you talk about this. And that's the kind of doctor I want working on me. So I appreciate it, man. Thank you so much for being here. But I'm not done with you yet.
Yeah.
Hold on a second.
Oh boy.
Question.
That's right. It's game time, my friend. Let's see how you do with your head information. You got to do well your time. So, all right. So let's see.
It is a PAD Awareness Month here in September, so if I do poorly, don't rat me out.
That's right. They'll hear this in October. You'll get a pass. You'll be fine. Right? So here we go. I want you. So which is better for PAD prevention? 2 intense workouts per week or 30 minutes of walking every day? Now let's look at the audience. What do you guys think? Nice intense workouts, but only 2 a week, or a 30-minute walk each day? You think it's the first one, intense workouts? Shane, put your hand up for intense. Oh, yeah, smart people. Or is it that 30-minute walk every day? Let's see. Have you been here before? You talking to these people? Is that what
Yeah, I have not been here before.
So now, and what is the reason behind that, Doc?
Well, the regular walking, because one of the main places where peripheral artery disease attacks blood vessels is in the legs. So just something so simple as walking helps promote that circulation, prevent, and even in some people treat some of their symptoms.
Really? And is it because it's breaking up things, or is it because it hasn't?
No, we think that the regular walking helps build detour, helps build service roads.
Oh, man, we're going to be using this one. I love it. All right, and I've got one more for you here. All right, so which one of these conditions often occurs alongside PAD? Is it high blood pressure, diabetes, high cholesterol, or all of the above? They didn't even wait. They all say all of the above. Is it all of the above?
Everybody was very awake. Yes, it's all the above.
Yeah. And is there, with leading these guys, because this is the first time I've ever heard this acronym. It's the first time I've ever heard of peripheral artery disease. And so I'm sure that there's a lot of things. If you were to say, listen, if you're feeling this, or this, you should get it checked out. What would those things be?
I think if you're having pains in your legs, or really if you have any kind of concern, make sure to advocate for yourself and talk to your doctors. Pain in the legs, especially pain with walking, is the typical sign of peripheral artery disease. If you have sores on your feet that take a long time to heal or aren't healing, that's another red flag. So please let somebody know.
And is it like a weakness, or is it a pain, or it could be either?
So if it's usually weakness, might be something else. In vascular disease, peripheral artery disease, it's usually like a Charlie horse feeling.
Oh, wow. Well, listen, this has really been a pleasure. This is the one more time I've got to talk about my little fun little community corner thing here, because we're really enjoying this part of our show. Thank you for showing up. Thank you for teaching us about this. Have a big round of applause for our Dr. Issam Koleilat. And we will be right back.
With Bob and Maria. Thanks for joining us.
All right, everybody, welcome back. It is now that time of the show for our partners with prizes. If this is the first time you're listening to us, every episode, we get some of our partners out there, trusted advocates, just partners in this healthcare field, and they're going to come and tell you a little bit about their business. And in return, they bring a nice little prize for our studio audience out there. So we got, let's see, this is Lars. Is it Lars Home Care? Layers. See, I can't do that. So Layers Home Care. And where are you guys at?
Our home base is in Matawan, New Jersey, but we service Monmouth, Ocean, surrounding counties. We do living care through the state. We're all over.
And tell us, so who are you guys? I'm sorry, introduce yourself to all these fine people, please.
My name's Ryan Lubischer. I am the Director of Nursing for the care management piece of Layers Home Care.
Oh, That's right. Take the whole microphone here. So, Ryan,
Patient to home care, to kind of all the layers across that. And when I'm not being a nurse, I have 2 little girls at home that I love to go to parks, go to zoos, and just have fun with.
and how about you?
My name is Linda Sullivan, and I do the marketing and sales for Lair's Home Care. I'm proud to say that we are 10 years, a family-owned company, and I am with them for 8 years.
Oh, wow.
Yes.
8 years. Wow. That's
In marketing years, it's about 120.
and you know,
Yes.
now, and you guys work with Harry quite often.
We
right?
work with Harrogate. We work in the surrounding communities. We do hourly care. We do overnight care. We have wonderful certified caregivers. We do live-in care. We do skilled. We do non-skilled. And Ryan's going to talk in a few minutes about our new program that we have. It's called Care Management. So in addition to our home care services, which are, we really go by word of mouth. We don't do a lot of advertising. We are family owned, one of the very few in the state of New Jersey. We also have a new program called Care Management.
Yeah, let's talk about care management. That would be awesome. So what is this new program, and what are we looking at here, Ryan?
So what care management really refers to is a nurse. We do it all through nurses only, coming in and helping to manage the care either for yourself, or sometimes it's adult children hiring us to help with their mother, their dad, aunt, uncle, making doctor's appointments, going to the hospital. You kind of touched on before about advocating for yourself. If you're not able to advocate for yourself, having somebody else to do that for you. And we believe in that very strongly, being a strong advocate and really helping them navigate a really complicated healthcare system.
Oh, it's no joke. I mean, I am exhausted from trying to manage the care, and I'm in this field, I mean, we have a lot of connections, and even with that, it's exhausting because you're dealing with so many different, let's just say, I don't want to say opinions, because that's not what it is. When you're dealing with insurance, doctors, hospitals, specialists, ER doctors, and then nurses on top of that, it can get really troublesome. And then if you navigate into the whole, hospice area or palliative care, it's over, because then you're putting another level on top. So, having someone that's in the field that can actually kind of cut through the chase and kind of get it out there, or even just to be able to know what hours the doctors are going to be there to find out what's going on. That's a really great idea, and I think something that's really needed. Do you guys run into a lot of pushback at the hospitals when you're doing advocacy?
I wouldn't call it pushback. I mean, sometimes there's a little, maybe they're not thrilled when they see me coming in, just because I do ask a lot of questions. Part of being an advocate is sometimes being, I guess we'll call it a little annoying. I need to know what's going on, what's our plan from here, because the patient, first of all, deserves to know that, and also does the family.
Well, that is true.
So, Ryan, will you take somebody to a doctor's visit?
Oh yeah, I'll go out to doctor's appointments for a few reasons. One is sometimes we don't know what questions to ask when we're sitting in the doctor's office, and you should always be asking questions. The other thing is it's a lot of information. If there's blood work you have to go for afterwards, they send you out to 2 different specialists. You need to change your medication. These are all things that I'll take note of so that there's not as much pressure on you to remember it. I'll be doing that for you and helping you navigate.
It's wonderful.
That's awesome.
Yeah.
Now, how many nurses do you guys have over there?
There's really, we'll call it 3.5, because some of us do it full time, some of us don't do it full time.
Yeah, that's great. I mean, I know most companies we're going to have 1 or 2, and it's a lot to go about. I mean, I know from being in the field, it's New Jersey's different. New Jersey's different when it comes to home care. I mean, you basically it's the nursing program is what you have. I mean, from the care plans to, following up on the care plans to making sure your ADLs, your IADLs, there's a lot that goes on. And from a nurse's, when you're overseeing home care, you've got to be careful, because there's the medical side of it, but then there's the mental side of it as well, right? It's what is it that's going to bring somebody, giving them a good day? What are the items? What music is in? What are the different things? So we're diffusing a situation. There's a lot of social work for sure that's going on. So that's pretty cool. Now, I'm guessing, is this an additional cost involved in the management piece, right?
Yeah, it's billed completely separately from the home care piece.
Can you just get the management piece?
Yes.
I think that's really good. That's a great thing for us to know, especially with, if you get caught in that. I will tell you from my standpoint, when, my dad, not my father, but my dad, my dad's great. My dad is he's a simple man. I love him. But he has these things that happen once in a while, and he'll call me like well after, it'll be like, oh, so I was in the doctor. What happened? Well, I fell. But and he's like, yeah, they said it might be broken, but I think it's fine. Okay, Dad, you know what I mean? And then I'm working, and then you're like, well, I need to go. It would be nice to have someone that I could call and say, hey, listen, can you just kind of manage my dad? Let me know what's going on, especially if they're from out, if the kids are in a different state, if the kids are in a different area. And, hey, everybody needs a side hustle these days. So the time that we used to be able to spend with our parents, it's not the same. It's not the same. I mean, so I think that's really, really great. And do you guys have like an hour minimum for your hour?
For hourly, we try to have a 4-hour minimum a day, 20 hours a week, but we do try to work with each person. When someone calls us and they look for care, we love to talk to everybody. And we're unique in the aspect that we talk to you for a very long time. We really find out what you want. We don't want you to feel like you're giving up all your independence and we're taking over for you. We want to make your day better. We want to make your life better. We want to make you happy. Yeah. So we try to talk to you. We try to see what your needs are and try to help you. And it makes us happy when you become a little more independent than what you were in the beginning. And when you get one of us in our company, because we are family owned, you get all of us. You get our manager, you get our scheduler, you get our other director of nursing, you get me, you get the owner. We talk every day, we meet every day. We find out where your likes are, we find out where you want to go, what you want to do, what you want to eat, who you want to see. So we really try to make it a unique, personal approach. And I think we've succeeded. 10 years, we really go by word of mouth only. And, we are just very happy where we are right now.
No, and I mean, that means a lot. It's kind of funny because as the world is, you guys see what goes on out there. It's all about the big operations. However, there's definitely something lost in translation. I mean, there's no way you can actually maintain that touch. I mean, I'm running through it right now to one of the companies that we're using.
Right.
And I trust them. It's just, they're too big.
We are 24 hours a day, 7 days a week, and we mean that.
Yeah.
We mean that. You can get in touch with us at any time.
Wow.
So,
that's huge.
If somebody calls with an issue, we don't just talk about it and hang up. We take care of it. We're most times in front of you within about an hour to try to help you fix it.
What's cool is we've had some home care companies on, but you guys really you love us. You seem like you really.
I wish everybody could work for my company.
Wow.
I wish everybody.
She says that.
I say it all the time, and I mean it with my heart.
I got to tell you, I did home care, and I don't know how you're saying that. I still wake up with cold sweats.
We love to meet people because they have such stories to tell us, and they teach us too. So we get a lot out of it. I know Ryan, as a nurse, gets tremendous amount of
I've worked in a lot of different places, but it's nice to be somewhere that there's not the big corporation kind of telling you what has to be this way or that way. It's family owned, and we really we treat each person like an individual, and it feels really good to be able to do that.
All right, so I got a hard question for you. All right, now this is one that I always wondered too. So now, for the most part, I would say I used to say this with our company as well. It doesn't mean that an aide is a bad aide. Sometimes personalities just don't work together. So how if you're you do want to make waves, but it's just not the right fit. How do you go about talking to the company? How are those calls gone? And do your aides understand that? Like, is that something that you do appreciate? Hey, it's not you, it's not personal, but you got to get the right.
Well, I think from the beginning, because we talk to you, we find out everything we can find out about our potential client. We have a pretty good idea going in. We're not getting you to sign paperwork and throwing somebody at you.
Right.
We're going to take a time to find out your personality.
Oh, wow.
And if we know that you want a companion and like a more friendlier person, that's one thing. If you want to be like, I only want them when I need them, that's another personality. And I have to tell you, we've hit it out of the park many times.
That's great. Well, that's what Marie was
Many
saying.
times.
Marie was saying to me, she said that they I'm sorry to put you on the spot, but Marie said that your aides are always fantastic. And that's like, that means something.
And a lot of our aides are, I'm with the company 8 years, the company's in business 10. A lot of our aides are there longer than I am.
Now,
So
do you have like the same, are your aides pretty much only with you guys for the most part? Like, do you have your family of aides?
Yes.
Yeah, that's
We have a
great.
lot of aides.
Yeah, I mean, I understand again. I mean, listen, people have to work, and I get that, but it really does mean something when you see the same people year after year in the organization.
Correct.
That's wonderful.
It means a lot.
That's awesome, man. That's really great. And so, home care is a very tough thing to navigate, and it's one of those things that you don't really know until you need it. It's not that, hey, you know what? I was just checking into home care. I just wanted to make a call.
And you could call us anytime. You don't have to hire us. You can just call us. If you have a question, if you're not sure, you might not need us now, but you might need us 6 months from now, and you might not need us at all, but maybe your neighbor does or your friend. And that's the important part. We'll talk to anybody.
Yeah.
So,
And when the will.
like it.
No, I think it's really great, and now you do have some information over here
I
that you
do.
can grab, and you guys are in this building at times, which is really great. I mean, that to me, that's
This is a great
that's
community. Harrogate's a wonderful
Yeah.
community.
It is. It's really it's a great place, and I mean but you gotta fit. I know that they also have high standards, so that says something for you.
They do. And on a personal note, my mom was here in the rehab too. They took care of my mom, and it means a lot to me, this place.
Yeah, I agree with you. So with that being said, I'm gonna play a game with you. Then we gotta give away something, right? So let's see how we do.
Ryan's really good at this.
We're gonna find out in a second.
He loves to answer.
Yeah, you love it? It's gonna be so good. Here we go. All right, now, I want to ask you, let's see here. Ooh, this is fun. There's a little mini game of aging facts or myths. Myths or facts. Okay, here's the statement for all of our audience and for you guys. Drinking more water helps prevent confusion in older adults. Is that actually true? If you drink more water, can it actually prevent confusion? Those that think yes, put your hands up in the air. Those that think no, put your hands up in the air. What do you think, Nurse Ryan?
I would say it's true.
You think it's true?
That is correct.
Yes, that is correct. That is correct. That's absolutely correct. Actually, believe it or not, and I thought this was interesting, your brain is about 75% water. So maintaining blood flow and oxygen to the brain is a big part of it. And when your body's dehydrated, your blood volume drops, reducing oxygen and nutrients delivering to the brain, and this can cause confusion and dizziness. So drink more water, and you're not going to get so confused. Oh,
Yep.
look, I got another one. I got another one. All right, here we go. Which vitamin is harder for the body to absorb with age? Often requiring supplementation. Ron, you didn't know this was going to happen, did you? So is it vitamin C, vitamin D, vitamin B12, or vitamin E? And once again, the question is, which vitamin is harder for the body to absorb with age? Is it C, D, B12, or E? Who thinks it's C? Who thinks it's D? Who thinks it's B12? Who thinks it's E? What do you think?
I think it's B12.
You think it's B12? Correct, yes, B12. That's right. Right, there is a rumor that has it that you were a big trivia fan, and here you are with this one. It is true. B12 actually is, as you get older, it's harder for you to absorb, and that's why many people have that supplement. So, guys, let's give a big round of applause to our partner surprises before we give away our prize. So, where is it? All right, so I got to show you the prize. Hold on a second. All right, so now you guys are going to be able to pick one of these.
Yeah.
Now, today's prize, hold on, I'm going to model this thing for you guys. I hear the one, I don't want to play it. Listen, you. Listen, it's nice and heavy. It gets brought up to your room. I will bring it up to your room. I will put it on your shelf for you. That's right. No, I'm not doing that, Ruth. It's not happening now. This beautiful flame is coming to one winner. Pick a ticket. Let us see it. Oh, baby. And the winning ticket today is number 36751178. Who's got 178? Oh, guess what? You got yourself a player.
Another number.
Call another number. What?
I'll only kill it.
Yeah. Oh my gosh. Chill on the kill. Give me another ticket. But well, thank you very much. Thank you very much. That is nice.
That was nice to be
You guys, thank you so much for coming on out. This episode will be, you guys are going to be seeing this in October. And tonight, our next episode will be going live tonight, the one from last month. So check it out. Welcome to The Scoop. And thank you guys so much. We'll see you again next month. Good night, everybody.